Hi everybody, my name is Anil Karapurkar. I am an endovascular neurosurgeon. I was a professor of neurosurgery at the KM Hospital, SIT GS Medical College, Mumbai, and I am now a consultant at the Breach Candy Hospital. Today I thought I would talk about radiation protection. Over the years, I have seen that we are quite nonchalant about being careful for ourselves. Radiation can be dangerous. You don't see the effect immediately, you see the effect after 15, 20 years. So I think we are quite blasé about our exposure, our own exposure. So we should be careful. So I thought I would spend some time on radiation protection for us. So it is important not only for us, but for our staff. So our anesthetists, our technicians, and of course, paramount our patient. We have to remember that the patient is exposed once, but we are exposed to it every day. But even the patient, how do you know that the patient has had exposure? You will find a focal area of balding on the head. If you have done a large number of runs, if your procedure has gone on for 2 hours, 3 hours, you will find the patient complaining of loss of hair. And big tufts of hair come off. In the beginning, for about 6 weeks, they lose hair, and then gradually the hair comes back. So if a patient tells you that he is losing hair and a patch has gone bald, usually it is a round patch either on the occiput or in the temporal area, either in the occiput or in the temporal area. Don't have to worry, this hair will come back, but it obviously means that the brain below is also getting fried. So be careful. You can imagine how much the patient is getting, but we are also getting. Exposure is inversely proportional to the distance from the tube. It is the tube which is the dangerous one. So you should make sure that, especially the staff, the anesthetists, the technicians, are far away from the tube. We also should be away. So one of the advantages of transfemoral route is you are far away from the source of radiation. You should always use the undercouch and the overcouch tube. So if you see this cath lab, there is an undercouch tube. In this patient, on this table, there are two flaps to it. You can have one single large flap, but most tables will have these two flaps. And if you look carefully, you can see the flap which is coming in from the ceiling from above. So that has to be swung in and out as required. Those ceiling suspended overcouch protections are of different kinds, but you should make sure that you use it every time. I think it is very important because the cardiologists don't bother. You will find that many tables have not even ordered. So if it has not been ordered, you must order it. I remember when we got our cath lab in Apollo, though it was a neuro lab, it came without it. And the local Philips, the engineers got the local guys to make a undercouch and overcouch protection for us. So you must remember that you must have that undercouch and overcouch protection. The sure sign of you're getting radiation is you will lose hair on your leg. The tibial and the calf area will be bald. So undercouch and overcouch protections are very important. So if you have the injector, you can also keep that injector on the table or keep the control of the injector outside in the control room. And when an acquisition is being done, move out so that you reduce the exposure. Maximum exposure is when you are acquiring the images, not when we are doing thoracoscopy or road mapping. To be even more safe, people have made a screen. So you can see just on here a large screen with holes cut out for the arms. So the surgeon sits behind the screen, he passes his hands through the screen, through the holes in the screen and operates. The Japanese have had one for a long time. The one on the screen just now is from Birmingham. This has been designed by a cardiologist. Anesthetists, we give them long lines, we give them a long ET tube, The endotracheal tube is connected to long lines, and they should not stand in the path of radiation. And as far as possible, whenever we are acquiring images, they should move away. So they turn the ventilator off if they want to stop the respiration and move away and come back in when required. So now we come to operator protection. So what are the things that we have the lead apron, we have a thyroid collar. One a cardiologist in Pune got brain tumor, following which most cardiologists have now got scared and they now use a cap which has a lead lining on it. We should use radio opaque glasses. In fact, these have been available for a long time. They used to be very expensive, but now the cost has come down. I have had bilateral very early cataracts. My one side was done in 1993 and the other side in 2001. I don't know whether it was related to radiation exposure or what, but fact remains that I had bilateral. Thyroid shield. Now everyone wears it, but Saruhan Sakirje, one of the leading interventionists from Turkey, he had a CA thyroid. His later wife also got it. So thyroid collar again is something that we must use. If you are young and you are likely to have children, you should protect your gonads. Boots, and of course, if you have that radio opaque panel, that is ideal. The lead apron. I like this kind of double-breasted lead apron. The weight is taken by the shoulder straps and by that belt. That belt which you see in the middle takes the weight of the belt of the lead apron. I'm comfortable with this, but my colleague Rakesh is comfortable with a double breast. So he's got one for the vest and there's a skirt for the lower part. So it's in two pieces, so you can use a two piece. Or you can have this kind. I'm not very happy with this kind. In fact, I feel that this does not give complete protection, but I'm sure that it has been, this is the one which is most commonly used and must have stood the test of time. But for me, the most comfortable is the first one, this double-breasted one, which comes across and has a strap in addition to the shoulder supports. Glasses. There are two types of glasses. One are like our regular glasses. You can, if you have a higher refractive error, you can even ask Kiran to make a specific uh, set of glasses for you. Or you can keep your glasses and use this kind. So this goes on and can be worn over your regular glasses. This is like a motorcycle strap. In fact, at Apollo, for my colleague who uses glasses, I had got this kind of special goggles. Radiation protection important for the cornea, for the cornea and the lens. This is the headgear. This is commonly available. This is like the old, if you have seen the war movies of Second World War. This was the kind of helmet worn by the motorcyclists. And this is another common one which is used at Bridge Candy. We have this. So it has a metal, I mean, it has a lead sheet in the cap on the forehead, on the frontal part. And it can be used 5 times. After 5 times, you have to throw it away. These are not very expensive. I think these are very safe. And those who are doing high volume should use headgear. This is for protection of the gonads. Of course, this is a kid, but you get them in various sizes. And gonad protection is also important, especially for the young. As I said, we are not very particular, but for instance, there are people who I know, have had their sperm saved in a bank so that in future, if they decide to have kids, they will not lose or have abnormal children. And then, of course, you have the boots. So those are the boots. I don't know who makes the boots in India, but I'm sure if we ask Kiran, they will make it for us. Another way is to get the head as close to the intensifier as I said earlier. Collimate. If we collimate, we prevent scatter, and that's how we reduce the. Also, of course, if the image quality is better, the screening is much better, but collimate is important. Reduce speed of acquisition. 2 frames per second is quite enough. And another thing I have seen is radiation counter is often not worn. I'm myself guilty of it now. If you are working in one place, then you should always use a radiation counter. You're working in multiple places, it may be difficult. But if you're working in one place, you should always use a radiation counter. And it should be given for evaluation as and when required. So, in short, this screen shows you what we should do for radiation protection. So, we should have a good lead apron, gloves. I didn't talk much about gloves. So, you get these thick gloves, but you also get a regular surgical type of gloves. They are heavy, they are a little clumsy. But there are people who use them and they are quite comfortable using them. I guess it is just a matter of getting used to having the gloves on your hand. But you do get radiation proof protection for the hand. So again, the evidence for that is that your nails become brittle. So I do have brittle nails, but I don't know again whether that is hereditary or whether this is a radiation exposure. But now, of course, I am not doing much. But when I used to do, we did have quite a bit of exposure. So you should always be careful. It is never enough, and take care and protect yourself, your colleagues, and your MSLs. Thank you. Thank you very much for your attention.